PET, otherwise known as positron emission tomography, uses radiation to show activity within the body on a cellular level. You might be told you need a PET scan if your doctor must diagnose a condition or to track how it is developing. Combined with a CT scan, a PET scan can produce multi-dimensional color images of the inside workings of the human body, which shows not only what the organ looks like, but how it is functioning. The specialist at the Center for Medical Imaging explained positron emission tomography and how it has revolutionized diagnostic imaging.
The PET CT scan, PET stands for positron emission tomography, and CT, that's a CAT scan, which stands for computerized axial tomography. So those are specialized imaging examinations that are performed when your physician feels that they're indicated. They're advanced examinations that give different information, but a complementary information, and actually fuse them together. We're able to image simultaneously while you're lying on the table 2 different exams. And then we're able, with the use of computers, to actually fuse those images so that we can be much more specific of what we're looking at. PET CT scans are specialized examinations that are typically used for cancer imaging, but it doesn't have to be. It really depends on what radioactive tracer that we inject into you. Typically, it is a metabolite similar to glucose. We tag that with a little bit of radioactivity, and what we do is image metabolism within your body. And cancer cells use a lot of sugar, so they tend to light up and are bright on PET CT imaging. The CT part is actually a separate exam than the PET scan. The PET looks at the activity. The CT scan is a very good image of your body anatomy. And what we do with the computer is we fuse those 2 images together so we can see where in the body the activity is abnormal. And that's what helps us determine what's going on. We're also able to use PET scans for imaging other disease entities, such as Alzheimer's disease, because how your brain handles sugar, the glucose, will be different in a normal person as opposed to someone who has Alzheimer's disease. If you need to have any further imaging or examinations performed at Florida Hospital Waterman, or if you need to be an inpatient at the Florida Hospital Waterman, all of those studies are available at the hospital. Patients should feel very comfortable and assured that the imaging that we performed at CMI meets the highest of standards. The radiologists and the radiology imaging department at CMI, as well as at the Florida Hospital institutions, all are accredited and meet the highest government standards, the highest national standards. We always seek to provide the latest state-of-the-art imaging and equipment for our patients, and we undergo constant quality improvement planning, constant review, and our protocols are up to date, and you're being provided the best of care at all times.
For more information on the board-certified radiologists at the Center for Medical Imaging, or to find out more about their numerous imaging procedures, please click the PET Imaging Tool story link icon on our homepage, yourhometownhealth.com.